With the population in the greater St. George area growing at a rate of around 3 to 5%, the medical community is challenged with trying to keep up with the increase and fluctuation of new patients. Washington County has a permanent population of around 165,000 people, but during the winter months, that number quickly grows between 40 to 50,000 people as snowbirds from across the country land here to take in the sunny, warm weather. An estimated 23% of the homes are now considered secondary residences for this transient population. Those who move here are advised to act right away in establishing health care.
Finding a doctor in St. George can be challenging, particularly with the growth that we have in our community right now. So I would advise people to get established quickly with a physician when they move here.
The problem is not new. Some years ago, Dixie Regional Medical Center set up a physician referral line to help people establish care in the community.
And as we get phone calls with people expressing difficulty in finding a physician, we can give them that number, 435-251-2299, and they can get access, in most cases, within a few days, to a physician office that can schedule them for an appointment.
While some doctors may be booked months in advance, others may not be accepting new patients at all. And those patients in need of specialty care may still have to go elsewhere for their care.
Because of the way the government reimburses, internists are more scarce across the country, and we have access through our clinical support lines with our facilities in northern Utah to some rheumatology support remotely, but we do not have rheumatology appointment visits available in St. George.
For those who don't have insurance or need some financial assistance, there's a doctor's volunteer clinic or the Family Health Center, which charges on a sliding scale. Draper says don't wait until you are ill or injured to find a doctor unless it's an emergency.
If it's an urgent situation, we have Instacares, several in the community. Go to an Instacare and they can also help direct care. And we have a Connect Care service that you can go online, search for Intermountain Connect Care, and you can access a physician from your phone.
Draper said currently there are about 350 doctors or physician's assistants providing care in the area. She said despite the possible shortage of certain specialty doctors, there are always physician's assistants and nurse practitioners that can also assist with patient care.
They can prescribe, they have oversight for qualified physician leaders.
Intermountain Healthcare is currently building a new cancer treatment center in St. George. Precision genomics will play a key role in treating cancer patients around the world. The new center is expected to be a major hub that will serve many, but not necessarily here.
They can work through their physicians to have their tests analyzed in St. George and receive that caliber of care right where they live, whether it's in Malaysia or North Carolina, Arizona.
With technology changing and doctors in high demand, it's up to individuals to maintain their own health by establishing a healthcare provider wherever they may go. In St. George, Melissa Anderson, CEC News.